delegates, please welcome back our International President, Dr. Naresh Agarwal, and our second Vice International President, Choi. Can I request our Leos to please push everyone back into the room? And if there is anyone outside, please ask them to come back. We are starting. Waiting for seat. He's not here. Nazi? Seat? I allocated one. She's going to come up with that certificate to do. Okay. He's coming. He's coming. Okay, just so you know, see if you know. No problem. Yes, yes. Okay. Did that lady call you? For the essay? No, essay. No, not essay. This will be the essay contest. Okay. Okay, I will call you. Who is saying? Huh? No, but who is saying that? Huh? Where is he? Here he is. Just keep these radio. Lions, Leos, ladies and gentlemen, welcome back. Hope you had a wonderful tea break and had a chance to see some of the great facilities that are available here at the United Nations. We'll start our program with a short video, which we call the Layla's Story. So please pay attention to the video.
I want to be a ballerina.
My hopes and dreams for Layla are that, she does whatever she wants in life. Layla was misdiagnosed 3 times. Go ahead and wipe your finger.
138.
138. Very good. She became really lethargic one day, and so her sugar was almost 700 by the time we got her to the hospital. The doctor told us that if we had not brought her in when we did, that she would have been gone in a couple days. All right, are you ready to call Daddy?
Yeah.
My husband's in the military. He's in the reserves.
Hey, Daddy.
He's also an OR nurse at the VA hospital. And so I do most of Layla's care on my own.
I don't want yogurt.
Well, we have a lot of carbs for this meal, and so we need to have some protein. You have to carb count, you have to weigh food, check sugar, all of that. People don't understand that type 1 is an autoimmune disease. Her pancreas does not produce the insulin needed to live. The Omnipod is the pump she uses. It's tubeless. We have to change that every 3 days. It's all done. He's worried about you. What are we waiting for? Cried the lion.
Nighttime is the worst. I live in fear every time I lay my head down, wondering if Layla will wake to see another day.
If I should die before I wake, it's really, really hard. I don't wish this on anyone. Your life revolves around keeping your child alive. She went through scent impression training, and so each glucose number has a different smell. Jubilee is trained on Layla's scent.
She alerts Mama so she can tell Mama if I am high or low.
She's also gone and fetched the meter.
You, good girl. Good meter.
Seeing Layla go through what she does on a daily basis has made me want to be a stronger person for her and for myself. My goal is to not only be the best mom that I can be, but to educate and advocate in her honor.
They stole our hearts and inspired us to do more for diabetes.
We were able to raise funds for JDRF and also raise funds to give to diabetes camp as well.
Having Amy and Layla come to our district meetings to speak, it made a positive impact on a lot of clubs.
As Lions, we're happy to help spread the word with Amy and Layla about diabetes.
I don't want diabetes to ever stop her. We want her to look at the world and know that she can take it on.
Wasn't that a touching video? Layla represents so many children around the world living with diabetes. There is currently no cure for type 1 diabetes, but as you saw, it can be controlled. Working together, we can help boys and girls like Layla to fulfill their lives. Our next speaker is leading efforts to advance the rights, equality, and empowerment of every woman and every child. As United Nations Resident Coordinator and UNDP representative to Kenya, he is working tirelessly to ensure that every individual exercises their rights, has access to health and education services, and is able to achieve his or her full human potential. It is my honor to introduce to you all Mr. Siddharth Chatterjee.
Mr. President Naresh Agarwalji, the Vice President Mr. Choi, distinguished delegates of the Lions Club International, members of the UN family, friends from civil society, and a particular acknowledgement to Manoj Shah, a fine businessman with a great humanitarian heart, just the kind of concept of humanity that we want everywhere in the world. I've watched and worked with him since 2014. and really a man that epitomizes exceptionalism. So I really want a round of applause to Manoj Shah for all that he's trying to do in making a better Kenya. I think it is a very opportune time to be actually discussing non-communicable diseases, because in all parts of the world, there is more mortality, more morbidity, more illness, more deaths because of non-communicable diseases like diabetes and all that, and Africa is catching up. Soon, in the next 3-4 years, there'll be more people dying, or there'll be more morbidity because of non-communicable diseases. I come from a culture in India where everything is celebrated with sugar. You do well in class, you get, tons of sugar. You do badly in class, you go into a state of panic and you still have sugar. You go to a friend's house, it's sugar. If you go and have tea with somebody, it's sugar. Everything has sugar in the culture. And what it has done is, as a society, it has made us completely dependent on sugar, because it is the new morphine. You're completely addicted to it. Sugar is an addiction. And there is a consequence for this addiction, that people start to get diabetes as they start to grow older, and that dependency, and therefore you hear about the amputations, you hear about the people getting blind. But do you know what? We as parents are partly responsible, because we feel in our great love of our child, here is a box of chocolate, I've been away in Kenya, I've got this to you from Dubai, take some chocolates. Are you with me? So inadvertently, what we are doing is we are engaging and engendering a culture which embraces sugar, and therefore business, everything responds to that particular need. It was like the cigarette industry that responded to the need of a population in the 60s and 70s. That's exactly what the sugar industry does. So let's say Manoj at the Tribe Hotel organizes a really nice feast, but at the end of it he puts fruits for you all. You'll say, oh, what a bad host he was. There was no cheese cake, and there was no creme caramel, and there was no ice creams. So we have to look at a collective change in our own behavior, because of our complete dependency on a poison which gives us a very short-term feel-good factor, but the longer term of that is obesity, is diabetes, is state of poor health. And therefore our bills go up, our health crises go up. Look at the amount every time. For example, in Kenya alone, 1 million Kenyans, in a population of 46 million, 1 million Kenyans go into poverty each year because of a catastrophic health shock. It could be anything, but it is health related. But what can change that? Is the right nutrition, is the right behavior, is embracing a healthy lifestyle, which used to be there. You didn't hear of diabetes and all that in India in the 40s, 50s, or even of late in countries like South Korea. After a meal in South Korea, there is no large amounts of dessert which are put there. They actually have a bit of fruit which is kept there, and you find it's by and large, if you look at that entire population, except in some of the cities where you have a McDonald's and all that, you'll find that the population is actually quite slim. So we have to have a mindset change, where being plump and obese in India, at one time it used to be thought that, you've arrived in life socially. So if you've got a protruding stomach, obnoxiously cantilevered over your legs, it was just assumed that, you've arrived in life and you're doing well. No. So it's changing that. We have to change the paradigm, and that paradigm will change when movements like the Lions Club can actually join together with the United Nations and say, look, the preventative side is much more urgent than the reactionary side, than the medication. I think the work that Novo Nordisk and all that are doing are brilliant. But what is it that we could do? What is it that we could do in terms of preventing it in the first place? What is it that we could do that we could engender that change in our own children? For example, I was in Switzerland before coming here in Geneva, and our son was born in the US. I had just moved to Switzerland, and I told my wife, I said, look, let's for 2 years not expose him to any form of sweets or chocolates. And I have to tell you something very interesting. I have a very strong, because of my background, as you can tell, the moment I see sugar around in the form of a chocolate or an ice cream or a kulfi or anything, you know, it's like a Pavlovian response. But with my son, I've noticed that the guy has the ability to, he says, oh, I've already had some, I'm okay with it. Now that's where that change has to come in. I used to work in Somalia. In Somalia, when they serve you a cup of tea, that tea, if it's not half full of sugar, that means they're being, you know, disrespectful. So I think the moment for us is to start looking at the granularity of change that is going to come. We can do all the campaigns out there and put up all the posters out there and say, oh, you know what? Sugar is bad for you and we should not. Let's go on to the bottom line. What are the contributors to diabetes? What are the contributors to obesity? What are the contributors to our becoming morbid and mortality in our lives? And the most important part is malnutrition. Malnutrition swings both ways. You can be extremely poor, but you can have access to all the sugar in the world. So you think this poor person is who's probably close to starving, but because it doesn't show, because the body has built up so much of glucose and has put on so much of weight, and you just assume, oh, no. And that's the challenge that we are confronting. You could be lean and obese. So I think structurally we need to look at what kind of changes can we embrace. And that's one of the reasons that I applaud the Kenyan government, for example, of engaging with what is called the Big Four. And the Big Four, one of the Big Four is universal health coverage. Universal health coverage is going to be the game changer for Africa in particular. What happened in Korea in the 60s and 70s and transformed that society from a, in 1953 from a $158 per capita, which I'll just repeat, which I said yesterday, to a $30,000 per capita per person GDP, is because they got two things right. The right education and skills, and the right healthcare. And that liberates people, because a healthy nation is a wealthy nation. It's a proven economic analysis. So I just think that fundamentally the way the Lions Club has taken this direction, in Africa it is even more pertinent, simply because Africa is actually at that stage where the Asian tigers were in the 60s and 70s. So the moment is now to make those investments of preventative health, right from the time a woman conceives, the care of that child, and that woman should start there. Stunting can even start in the abdomen. I mean, and therefore her own nutrition, her own well-being is going to be important. People will produce more children only because they are uncertain how many will survive. And the way that it also changed, in South Korea too, the total fertility rate was the same as Kenya today, 4 in the 1960s. And then they started to bring the total fertility rates down. So what we are looking at is an opportunity in Kenya and in Africa, where over 70% of the population is less than 30, highly youthful. But the person that is working on a farm is 61 years old. The median age of the population is 18. So what we want to do is start looking at impressing on what I would call a trident of good health, good education and skills, and good employment and empowerment opportunities, where the gender aspect is going to be crucial. Disease burdens have a gender side to it. You'll find there are more ill women than ill men. We have to start addressing that, fundamentally start addressing that. Because it is only a healthy girl who will become a healthy woman, who will raise a healthy family and be able to, put into intergenerationally more healthy people. Men can't do that. They are not even programmed that way, and men need to come into that force. That is where, again, Lions can make a massive change, about men taking responsibility of the way they can actually share the burden of responsibility in rearing their children and bringing them up, and reprogramming them to understand the benefits of this. So health has a gender dimension to it. So the convergence of gender with good health is going to be that crucial game changer. We are not going to have enough of doctors, ladies and gentlemen. We are 50% short of doctors and nurses in Kenya and in Africa. By the time we come to 2030, where Kenya's population, which is 46 million now, will be 65 million by 2030, we'll be about 60% short. But I'm not sure that one has to really worry about it because technology is going to help us leapfrog. Is there a doctor in this room? A medical doctor? There you go. Now, for a medical doctor to be able to actually access a patient now in Mandera County through a video system and through an artificial intelligence process where the picture of someone's eye that I was just in the Silicon Valley, they can analyze it in like 15 seconds and tell you if this person has diabetes or not. So you can actually start doing consultation remotely. That's going to be the future. This is again a place where Lions can come in and bridge the future. Bridge the challenges of distance and time with technology, with artificial intelligence, with machine learning. So which means that it's also revamping the way we do business. No, it's not about setting those stalls up and taking 20 trucks and say, oh, you know, we've come here to give you food. That chapter is over. Ladies and gentlemen, forget that. You know, what you're doing is you indignify the process of aid giving when you take 20 trucks and put up your tents and stand there in your jacket and say, oh, you know, here is food and you've been hungry. Well, you've addressed it for 2 or 3 days. What happens after that? So, it's probably a moment where we start to say, all right, you know, let's look at what can be that transformational aspect that our movement can bring to bear, where others start to follow us. Perhaps even the UN will start to copy what the Lions Club is doing. You have the agility, which a lot of us don't have, because we have, you know, very strong processes and procedures. So what we are looking also at the Lions movement is leadership. Leadership, partnership, coming together with us where we can impact not 10,000, not 30,000, not 40,000, but the count should be in millions. And I'll just tell you one secret. Africa is the future. And I don't say this lightly. With such a young population, the way this continent is going is only upwards. The way the Asian tigers started in the 60s and 70s, they are experiencing what is called a demographic echo. That means they're aging. But they've got rich before they started to age. That's where we want to take Africa too. But for the Europeans and for the Asian tigers and for the world, for the United States, the future markets are here. So if you don't have a market which has disposable incomes, how will that change? And a disposable income will happen when there's a man and woman who are both healthy, educated, have the skills and are earning an income. They have a disposable income where they can provide better nourishment, better education, better skill sets, better opportunities to their child. That's what makes the intergenerational change. So it's absolutely logical. So the direction that you've taken on public health and in particular lifestyle diseases, because diabetes is a lifestyle disease, that's where the transformation is going to happen. That's where you can say, let's start making that revolutionary change rather than a slow, evolved process. Where it's not 20 truckloads of food coming, but it's 5 people from Lions who've engaged with the community for a couple of months and said, look, this is how we are going to start transforming. This is how our agriculture is going to be done. This is how household nutrition will be done. This is how you need to start cutting down on food that cause you malnutrition, and that includes diabetes. That should be the kind of change agent that you can start becoming. Global influencers of behavioral change. That is what is going to be crucial to prevent non-communicable diseases. So I believe the sky is the limit. I think the timing of this meeting is just fantastic. I mean, you know, I really believe that Kenya is a country which is a beacon of hope. You get it right here, it'll quickly assimilate into the neighborhood. This is where the growth of the economic growth, the giant economic growth, the model of economic wheels are just rolling, regardless of moments of pause and political tensions and all that. Those are processes of democracies. It's evolutionary. But where we are coming to is an opportunity where we can actually change the paradigm. And that's what we are talking about, not the process, but that paradigmatic change. And I think, you know, when I hear Dr. Agarwal, and he says, you know, the we constituting the wheels of change. which doesn't evolve but revolves and changes intergenerationally, the leapfrogging that is needed. We don't have to go through the challenges of industrialization and all that the West and other parts of the world went through. We can actually jump all that. We don't have to go through the hardship of the public healthcare system in the West or in the Asian tigers that they went through. We can change that because we can jump that. It's like our children who are born, they can actually pick up a mobile phone device or an iPad, and by the age of 2 or 3, it's the best nanny that we could ever afford to have, right? Whereas if I put a phone with a dial thing in front of my son, he'll think, you know, maybe it's a little boat I brought him. That's the difference. That's the opportunity of change that we can actually manifest, where we use technology at our disposal and start to make those changes. The first thing that a kid who puts on television should be able to see a Lions Club member and telling that kid, hey, you're having too much of chocolate or something. A message on the iPad, a message on the device. That's the conversation I had with Facebook. I said, the influence that you guys can have. In Silicon Valley, I was meeting with their artificial intelligence people, and you know, I was just struck. The basic age group that I was dealing with over there was 24. I felt like a grandfather in front of them. Kids. But brilliant. I mean, you know, maybe there was something they were born with also, but just absolutely brilliant kids. And he said, so how can Facebook help? I said, you know, just imagine that the moment I put on my Facebook thing, one message comes through, wash your hands. Second message comes through, cut down on sugar. We can actually start to influence this. Those are the kind of partnerships which can actually get Lions into every room, into every iPad device, into every mobile phone. Are you getting me? That's the kind of change I'm talking about. And that's the kind of partnerships we can forge here. And I can tell you, in Kenya is a place you can actually do it. I've worked in some of the remotest counties with Manoj in Mandera and Wajir and Marsabit. I mean, these are counties that many of you may not be able to even spell. But recently, even Forbes magazine has put Mandera County as one of the places where the international community and the government have reached some of the most remote places, a place which had maternal mortality rates as high as 3,795 per 100,000 live births, has dropped to 500 in a matter of 2.5 years. This is impossible. And it's not because that the international community did it. It's because it was self-driven. It was the county governors. It was the county health authorities. It was the Ministry of Health saying, listen, we can't just afford. Kenya was embarrassed by the fact that it did not achieve the Millennium Development Goal number 5. Let's set that right. Let's push on. They introduced the free maternal health care policy. The First Lady started the Beyond Zero campaign. The international community galvanized around this. Now we can actually go 10 steps ahead. So join us in that journey of going that 10 steps ahead. And if we, as I said, we get it right here, we can get it right in the entire ecosystem around in Africa. Because as I said, fundamentally, it is going to be access to good primary health care, good education, good skills, and gender equality which will transform Africa. Otherwise, nothing else will. Thank you.
Thank you very much, Mr. Siddharth Chatterjee. I think that was really inspiring, and we also appreciate the small jokes that you made in between. Thank you very much for that address. Our international president would now like to present you with a gift, and I would request Dr. Naresh Agarwal to please come up.
Friends, I have already explained to you about this is the winner out of the 600,000 children, the peace poster. Fantastic. Very good message. I think simply, if I remember, Lions, let's constitute the wheel of change. Lions be the wheels of change. That's the power of we. And let's go 10 steps ahead. Let's give a big round of applause to our very learned speaker. It's a privilege and honor for me to present to Sid Siddharth. I mean, the head of the person here. Thank you very much, head, for hosting us and for giving us all this privilege and honor to be here in this beautiful auditorium of the United Nations, Nairobi. Thank you very much, friends.
Thank you.
According to the United Nations World Health Organization, approximately 205 million women around the world, which is about 8% globally, are living with diabetes. Women, especially those in low-income countries, are particularly vulnerable to this disease. Before we hear from our next guest speaker, let's have a look at how Lions are helping empower women and girls.
I was a battered woman.
I was sleeping on the streets for about 7 years.
Being a lion changed my life.
Ich 9 Monate hier deutsche Kurs anmelden, hier ungefähr 50% Chance, Arbeitsplatz.
স্বপ্ন আমার পুরো হয়েছে, আমার কারিগর বেড়েছে, আমার উন্নতি বেড়ে চলেছে। আমি টাকাটা নিয়ে বেরিয়েছি কারবার এবং আমার পরিবারও ভালো আছে।
From homelessness to talking to you right now, it's a miracle. This home was important for me to open up because I know a lot of people that are homeless who don't want to be homeless, but somebody give them a chance, it can change their life.
Karena Lion saya di sini bisa meriksa kesehatan, jadinya tahu dah ya gitu tentang kehamilan saya, apalagi.
Gracias Leones. Merci Lions.
Thank you Lions.
Shukran Lions.
ধন্যবাদ.
Thank you Lions.
Thank you Lions.
Thank you. Thank you. Thank you. We are so grateful.
And I became a lion. And the lions have taught me how to live my life. And they let me feel like there's nothing I can't accomplish. There's nothing I can't do now.
Lights, please. Bringing to the United Nations over 15 years of development experience in the areas of gender, reproductive health, rights, and HIV/AIDS, this speaker's expertise extends to her advocacy role in the promotion of women's empowerment and gender equality. Please welcome our country director for UN Women in Kenya, Ms. Zebib Kavuma.
International President, Dr. Agarwal, Second Vice President, Mr. Chua, Lions Chairperson, Dr. Mehta, the Lions Co-Chairperson, Dr. Shah, the members of Lions Club around the world represented here today, distinguished guests, ladies and gentlemen, a very, very good afternoon to you all. Now, I think I need to start by thanking the Lions Club International for giving me this opportunity to be talking to you today. And also, I feel very honored and very privileged to be here celebrating the 40th, I believe it is, annual Lions Day, and also marking the 73rd year of partnership between the United Nations and the Lions family. I think we need to celebrate that. Thank you so much. Thank you. Now, in September 2015, if you all recall, the world came together and adopted 17 crucial goals towards sustainable development as part of the 2030 Agenda. And key to that was gender equality. And why it was key is because it was ensuring that women and girls are guaranteed for their full and effective participation, unlike the Millennium Development Goals which were driving us prior to these ones. For the first time in history, we can actually say that the whole world has come together and agreed that there is an expiration date to gender inequality. And that expiration date is 2030, less than 15 years from now. Now, the Agenda 2030 is very bold, and it is also very clear. There can be no sustainable development without gender equality. And this commitment is prominent, it's comprehensive, and it's also cross-cutting. So the 2030 Agenda holds the potential to transform the lives of women and girls around the world, promoting inclusivity and improving the lives of those left furthest behind. This, ladies and gentlemen, is about social justice, and it is not about charity. We need to learn to accelerate our responses, our interventions. We need to get out of our comfort zones and do the undoable. And we need to do business unusual, not business usual. I really want to urge us to have a sense of urgency on these matters, because less than 15 years is not a long time to go. And let it not just be a purpose, but let it also be something that we can deliver collectively. Now, when it comes to SDG 3, as had already been highlighted earlier this morning, which is good health, Member States have set an ambitious target to reduce premature mortality from non-communicable diseases. Of course, this includes diabetes. And this is supposed to be done by 1/3. The second one is achieve universal health care coverage. And the third is to provide access to affordable essential medicines. And all of this to be done by 2030. Now, statistics don't lie, and it's always good to remind ourselves where we stand. And we will see from the data that I'm just going to mention that women and girls are definitely adversely affected by non-communicable diseases, such as diabetics. Now, diabetes is the 9th leading cause of death in women globally, causing 2.1 million deaths a year. There are currently over 199 million women living with diabetes, and this total is projected to increase to 313 million by 2040. 2 out of every 5 women with diabetes are of reproductive age, accounting for over 60 million women worldwide. Women with diabetes have more difficulty conceiving and many have poor pregnancy outcomes. Without preconception planning, type 1 and type 2 diabetes can result in a significantly higher risk of maternal and child mortality and morbidity. 1 in 7 births is affected by gestational diabetes, a severe and neglected threat to maternal and child health. So this already shows us that we have a lot to do. And if we don't accelerate our interventions and do them collectively, we will not see the end of this. Now, why are women affected? Why do we see these kinds of statistics? And it goes back to the basics that we need to talk and we need to dialogue on and we need to embrace ourselves on. These are the gender roles that society has put upon all of us. Multitasking and power dynamics all influence vulnerability to diabetes and to women in general. I think last night when we were at the dinner, we did, forgive me, I don't remember the lady's name who was recognized by the representative from Pakistan and praising her for her multitasking efforts, which is fantastic to know that women wear multiple hats and they somehow manage to cope. But it is always at the detriment of their health. So as much as we are trying to praise women for all the good things that they do and all the deliverables that they can achieve, we need to also step back and understand and say, is this humanly possible? Can we continue to play these kinds of roles? Can we continue to live according to the gender stereotypes? Or do we need to dismantle issues of patriarchy? Do we need to dismantle who gets to define what is the role of a boy or a girl? What is the role of a woman or a man? Because when we are born, again, as had been mentioned already by our international president, we are the same. If I wrap a blanket around a baby boy and a baby girl, none of us would be able to tell whether it's a boy or a girl. It's only socialization that teaches us that we are different and that we need to do different things. And therefore, our opportunities as girls and boys will differ as a result of that. And if we do not understand and change the way we socialize, issues of these, such as health, such as education, social protection, all of these issues will not be addressed in a timely manner. We also face stigmatization and discrimination. And these are particularly pronounced for girls and women who carry a double burden of discrimination because of their health status and the inequalities perpetuated in a male-dominated society. These inequalities can discourage girls and women from seeking diagnosis and treatment, preventing and amplifying the impact of diabetes on them. And this is not just for diabetes, it goes for anything and everything. And I'm sure if I ask every woman in this room, they have been challenged in one way or another just because they're women and they want to stand up and speak up. Consequently, women around the world have less knowledge about the possibilities for care. They have less social support and protection, unequal access to family resources, and fewer travel opportunities to seek care elsewhere in comparison to their male counterparts. Now, with the rise in diabetes prevalence, the level of awareness among the public remains quite low, and it stands at about 30%. And this is according to the World Diabetes Foundation. This further worsens the situation as most conditions go undetected, carrying long-term risk of type 2 diabetes, especially within marginalized communities. Now, when we look back about 10 years ago, or 12 years ago, in 2006, there was a UN resolution on diabetes. And this was an important step in the right direction, because it recognizes the costs of diabetes locally and globally. It designated the World Diabetes Day and called on governments to develop national policies targeting the prevention and care of diabetes. National policies were to alleviate risk factors and improve management and care of diabetes. Now, 10 years on, there has been some movement, but clearly it's not significant enough to create the change that we want to see. So in 2017, the UN World Diabetes Day had called for promoting affordable and equitable access for all women with diabetes or at risk of diabetes to the essential medicines and technologies, self-management education, and information they require to achieve the optimal diabetes outcomes and strengthen their capacity to prevent the type 2 diabetes. But clearly, as I stand here, we all know we still need to do a lot more. Now, being the United Nations, when we look at the international level, still more needs to be done to promote the importance of affordable and equitable access for all women at risk for or living with diabetes. And they need essential medicines, as we already know. They need to tap into the technology that exists today. And more importantly, like we said, they need to be able to self-manage. And access to information is critical for this. For targeted and effective responses, further research also needs to be carried out on the gender specificities of diabetes. Current studies of access to and treatment are insufficient, and future studies must collect gender-specific data to better inform policy and decision makers to allocate resources responsibly. We all know any kind of a disease affects men and women differently, and we cannot assume that the research is just neutral to the gender and the needs. At national level, equally so, equitable health care needs to expose and improve gender-sensitive approaches to prevention and delivery of care for women and girls. We need to recognize that effective diabetes diseases prevention and control do require true leadership. And I think we can say here that the Lions and the Lions family are that true leadership. And I applaud every single person for that. I also want to recognize that you carry out a deliberate and coordinated multi-stakeholder engagement. And this is what the partnership with UN is all about. But as has already been said, the partnership goes beyond the United Nations system. It is around the world. And this is what we need to see more of. This will promote and strengthen public, private, and people partnership. And I want to emphasize public, private, and people partnership. That is what we need. Without that, we will not progress. We need programs at community level, which you are already doing so ably, to improve nutrition, right? And also increase the physical activities in schools for children, for boys and girls. And we also need to strengthen the parent-teacher associations, for parents to also understand and take a role in their own homes to be able to nurture in the right way and be able to understand what prevention and what care and what cure means. As Sid had already mentioned, in Kenya, access to universal health care is one of the big fours of His Excellency the President. So of course this also gives us an opportunity to be able to deepen our conversations and our interactions in combating diabetes here in Kenya. So we're also looking forward to that. Now finally, I would just like to say, improving women and girls' health will require cultural change. And it has to be done at the individual and at the household levels. And institutions also need to acknowledge the daily challenges women and girls face because of the perceived gender roles and stereotypes in society. It is a journey we must all embark on and take the responsibility to do our part in our own little way. All interventions need the voice and participation of women and girls to addressing issues of inequalities in a viable way. 50% of the population are women. There is no way we have the luxury to ignore what these women have to say, have to do, have to give. This is essential and non-negotiable to create inclusive, equitable, economically productive, and healthy societies where no one, and I repeat, no one, no woman, no girl is left behind, and rather where every woman and every girl will count. In the process, let's remind ourselves and always celebrate ordinary people doing extraordinary things as yourselves. Let's make gender equality a lived reality for all of us by joining hands and fostering partnerships also to combat diabetes. Let's step it up. Let's keep stepping it up for gender equality for 2030. I thank you for your kind attention.
Thank you, Nausa, for that. I thought it was only Kenyans who could do it, but I see it's something common in Zambia as well. Thank you. Thank you very much, Zebib, for that very inspiring speech and for sharing this wonderful information and also the mind-boggling statistics that you shared with us. I mean, that was really, truly, and I'm sure many delegates here will appreciate the information that you have shared with us. I would now like to request our International President, Dr. Naresh Agarwal, to please present a gift of appreciation to our speaker. The morning session is now coming to an end. We have much more in store for you this afternoon. So please be back in your seats by 1:25 so that you don't miss out on anything. The lunch is outside this conference room to your left in the fountain area. But before you go, ladies and gentlemen, please welcome back the Sarakasi dancers.
Strong lions together. together as one. We are one. With the heart and power of service we move. We are empowered to be where there's a need. Yeah. Whoa. We are the lions. Whoa. We serve. Whoa. We are the lions. Whoa. When we serve, every cry. So we serve, yeah, whoa, we are the lions, whoa, we serve, whoa, we are the lions, whoa, we serve. Let them be healed with our compassion. Yeah. Let them be filled, and let them be loved. Whoa, we are the lions. Whoa, we serve. Whoa, we are the lions. Whoa, we serve. Whoa, we are the lions. Whoa, we serve. Whoa, we are the lions. Whoa, for 100 years we've served.
We are the lions and we serve. That is our international president's theme song for this particular Lionistic year. Ladies and gentlemen, before you leave, I would like to request our international president, Dr. Naresh Agarwal, to please come up for a special announcement. Request all delegates please to take your seats. Leos.
My fellow Lions, with a lot of grief in my heart, I'm going to share some of the very sad news before you go to lunch. Friends, a man, I know we are in the, I'm really shaky to speak even, how much he was attached to us. I know we are in the midst of a very important business, important ceremony which is going on. But let's all remember a man who did more important work than anyone I know. I just very sadly share with you our very dear Lion, a leader, a friend, a guide, a mentor, SP Mean is not amongst us. Just, excuse me. SP gave his life to so many. It seems impossible that his own life can be taken away. Even now, I expect to see him anytime, any moment coming in. It sounds crazy, but I expect to hear his voice. Is this what is called a spirit? If so, his spirit is right here with us. It is now time for him to rest in peace. We will all carry his mission. No words can do justice to his life. Instead, our humble tribute will be to walk his path of sacrifice, service, as long as still we have the privilege of had his privilege as a life. My friends, 25 years of service, living, breathing just for Lionism. Very sincere man, down to earth, giving his life to whosoever is met. He was a magnet, very sincere, a very godly person, and I'm not finding the right words how to express my grief and grief of all of you. I understand how close he was to all of us. He left us about 2 hours back. Manoj shared this news to me. It was hard to take it. But friends, when I was hearing this song, our song for this year, We Are Lions, we served 100 years. And today, I would like to dedicate this song to the soul of that very dedicated lion, a pious soul. This song I dedicate to him. May we all rise, pray for peace to the departed soul. Thank you.
Long live SPME.
Let us all live his ideals. Let's live what he was always thinking, dreaming for the welfare of the poor, afflicted, and the downtrodden. So thank you. Long live Lionism. Long live SPME. Let Lionism live through the veins of SPME, which flowed in his heart every time, whenever he... Even I just, friends, tell you, he was waiting for this function, this meeting to happen. Manoj just told me, Naresh, even when he was going for his surgery in London, he shared, make sure this is something remembered by the lions. Make every lion comfortable. Ensure that everybody has a nice food. He was so caring, so much passionate for each and every one of us. To me, he was a mentor. He was a fatherly figure to me, my dear friends. So the loss is irreparable, but you know, this Almighty's will is more stronger than any one of us. And everybody has to go. Only thing is, let's see that we live his life. We live his dreams. Thank you very much once again. May I request Lohar to now please continue, and whatever are the announcements.
May the Almighty rest the soul of past International Director Dr. S.P. Amin in peace. Ladies and gentlemen, we'll now break for lunch and request you all to be in this hall by 1:25. Thank you all very much. There's a VIP tent.